All right, in the next 5 minutes, I'm going to talk to you about carboxy therapy. My experience, we did a clinical trial and a small little trial about carboxy therapy, which is CO2 facial. CO2 is, you understand CO2, you all know very well, and it causes smooth muscle vasodilation. It also increases vascularity. It helps tissue drainage and creates better circulation and lymph drainage as well from the areas in which it's located. It has an effect on the extracellular matrix, it increases fibroblasts, it breaks down fat. So CO2 to the tissue, it's an acidic environment, and it increases blood flow to the area to try to get rid of the acidic environment. Now, you remember the Bohr effect from medical school, I'm sure you do. That's where hemoglobin is much more attracted to CO2. When there's CO2 in the area, hemoglobin grabs the CO2, drops off the oxygen, increases the partial pressure of oxygen in the local tissues. And this has been used for aesthetic reasons since 1995. Now, carboxy therapy is nothing new. In the 1930s in France, there was carboxy baths, and people who had poor circulation would sit in these carboxy baths. But for aesthetic reasons, it's shown benefits to fracturing adipocytes, increasing triglycerides, as well as increasing the vasodilation to areas, increases collagen fibers, fibroblasts. This could have significant benefit to areas which you need increased blood flows. Then let's think of situations like flaps, where it can be very helpful, following facelifts, or maybe even vascular occlusions is maybe a potential usage of using CO2 in the future. So we looked at CO2 masks in combination of patients who had a CO2 laser procedure, a fractionated laser procedure. Now, Neil Sadek as well as Zoe Draelos have done clinical trials showing its benefits. Neil Sadek after a radiofrequency treatment, and Zoe did it in a short term, after over a 2-week period of time, or over a 10-week period of time using a CO2 mask. So this is a novel way of giving CO2 to the skin. We took 8 patients, we treated them with the fractionated laser, we gave them the CO2 mask 1 hour before, immediately following the CO2 laser treatment, and then 5 more times over the next 2 weeks. And then as the placebo was just a couple patients getting the traditional Aquaphor treatment. Measurements afterwards, we looked at a whole host of measurements, qualitatively, quantitatively, as well as subjective patient results and adverse events. The treatment we use is this carboxy therapy, which is these 2 packages. You mix them together, you get a chemical reaction, which then releases carbon dioxide. I'll show you quickly what it looks like. The mask stays in place for 45 minutes. So I don't have a ton of time. I wish I did, because this is 5 minutes in front to give you all this information. But this is what it looks like. It's very simple and very easy to do. You mix it like this, place it onto the face, and then afterwards we peel it off. It comes off in piecemeal, and then we do the CO2 laser, and afterwards we put it back on. All right, blind investigator assessment. So this is the blind investigator looking at the before and after pictures, what they see in the first week. Patients had decreased crusting and flaking, so it looked like they healed much quicker. This was similar to what Neil Sadek saw as well. And we had decreased erythema. Investigators looking blindly at photographs. This is a before and after patient. The top is the CO2 lift, the carboxy therapy lift. Bottom is the placebo. So the photo is kind of hard to see up here, but decreased redness in the patients who got the CO2 lift. Subjects, they also thought they healed faster. They had less crusting and flaking, less tenderness, less itching, all in the first week. What are the blind investigators looking at the long-term results after 2.5 months? Decreased coarse lines, and also they had subjective assessments of less wrinkle severity. So those were long-term effects we thought of having this treatment. Now, patients, what did they find after 2.5 months? They thought they had lower wrinkle severity scores, which I thought was impressive. Improved appearance, their skin looked more youthful. They were likely to recommend it to others, and they would continue the regimen. And most importantly, I think when the patients had this treatment, they felt they had improved confidence. And I always like that afterwards, the patients tell me they have improved confidence. So this is one of our patients who got the treatment. You can see 84 days later, she looks pretty good. You know, is it CO2? Is it the laser procedure she had, the fractionated laser, or is it the carboxy therapy mask? Hard to say for sure, but in conclusion, carboxy therapy, the mask is safe when applied right after CO2 laser, which I thought was important because you have a epithelial surface that's denuded. Faster wound healing, greater improvement in facial wrinkles, coarse lines, as well as photo-damaged skin. And these are issues that affect patients. Patient satisfaction was also very high, so they liked it. So I think that for patients who are coming in who are worried about the downtime after getting a fractionated CO2 laser, this is an option so that they can heal faster and perhaps get a long-term benefit that lasts. Also, I would urge you to consider this for any patient who seems to have ischemia. Maybe perhaps CO2 lift is a way to increase partial pressure oxygen to the local tissue. Thank you so much.